Now there is going to be a stress testing or exposure of a sample to little harsher conditions, right? Such as light, heat, humidity, acid, base, hydrolysis, and oxidation. So these are the preferred conditions under which you have to expose your sample. What is the intention behind exposing the sample at these conditions? Hmm? You need to understand maybe the degradation pathway, or maybe the intrinsic nature of the molecule, isn't it? So this is the purpose of what impurity is getting generated during that will be discussed of force degradation outcome. Now, when it comes to NVISA, Brazil guideline, now there is a little difference, and you will see the difference over here now. So it says that the wide pH range, oxidation, and plus there is going to be a oxidation by metal ions like copper 2 plus and ferrous 3 plus. Heat and light is also there. So this is the additional condition which is recommended by NVISA, metal ion oxidation, which is not generally required by ICH and the three different regions like US, Europe, and Japan. So please take a note of this very important point. Additional oxidation of from the metal ions like copper 2 plus and ferrous 3 plus. Let us now understand the test to be exempted. Now this is a very important point. What test can be exempted from the force degradation? Now if you want to look these details in the ICH guidelines, you will not find any mention about what test procedures can be exempted from the force degradation, right? There is no mention about which procedures can be exempted from the force degradation. But when it comes to NVISA, NVISA has clearly mentioned the following cases shall be exempted from the demonstration of force degradation. So performance methods. What is the example of performance method? What is the example of performance method which can be exempted from force degradation? Hmm? Do you know what is my performance methods? Anything, any test procedure which is going to define the performance or any specific characteristics which is very important for the application or utilization. Like Mena says, dissolution is a performance characteristic. Hari says dissolution is the performance characteristic. Deepak says dissolution and particle size distribution is performance characteristic. Maybe the viscosity of a polymer can become the performance characteristics, isn't it? You understand the performance characteristic now? So whatever performance methods you are going to design, we are going to validate. For those methods, force degradation is not required. The second important point is non-chromatographic methods. Now, what are the chromatographic methods? First thing, hmm? Chromatographic methods are what? Chromatographic methods like maybe the liquid chromatography or HPLC, you will say. Yeah, separation methods like separation methods, HPLC, gas chromatography, TLC, ion chromatography. So these all are the chromatographic techniques. What are the non-chromatographic techniques then? Non-chromatographic, like maybe UV, exactly. Thank you so much, Sagar. UV, IR, isn't it? So these are called as non-chromatographic techniques. And for these techniques, your force degradation is not required. And the third point is NMR is also one out of that, Himan. And the next one is the use of a method with technical limitation for selectivity. Now, what are the methods which have the technical limitations for selectivity? Selectivity means interference cannot be identified. Potentiometer, absolutely. Titration, thank you so much. Isn't it? So titration, you cannot have any uh, special technique to remove the interference, right? Titration, potentiometry, isn't it? So these are the techniques for which FD is not required. I hope you are clear what is definition of FD and which test can be exempted from conducting the force degradation. Type in U for understand in the comment box before I move on to the next point. Thank you so much. Appreciate that. I really appreciate your response. Hmm. Okay. Now the next point is what acceptance criteria. Anyone knows what is the acceptance criteria for force degradation? What is acceptance criteria? Okay, Akshara says 5 to 20%. Excellent. Manoj Kumar says 5 to 20. Sajia says 5 to 20. Oh, many of you are. Vijayanta says 5 to 20, 5 to 20, 5 to 20, 5 to 20. Many of you. Sagar, Sanjay, thank you so much. See, as per as the acceptance criteria for force degradation, now there is no defined number in the ICH guideline. There is no defined number in the. But when it comes to NVISA, now there is a specific resolution passed RDC number 58. Now this is a guideline which talks about how to conduct force degradation, right? This is published by the NVISA. Now what this guideline says that the test must promote a degradation greater than 10% and lower than that which would lead to complete degradation of the sample. Means at least 10% should be expected degradation according to the NVISA guideline. How much percent? Type in 10% in the comment box. But there is no reference provided by ICH or any another guideline. So at least in this situation, NVISA is giving some information on post degradation. Thank you so much. And there are some responses I could say in the chat box that talks about the mass balance. Yes, of course. Now the mass balance is very important for radiated substances or impurity testing procedure. So what is meant by mass balance? What is meant by mass balance? Mass balance is like energy, right? Energy cannot be created, cannot be destroyed. It can be only converted from one form to another form. Same is the case for mass also. Mass neither be created nor be destroyed, can only be converted from one form to another form. This is called as a law of conservation, isn't it? Law. Now, when you talk about mass balance, means what? Initial mass is going to be equal to maybe the final mass. Now, what is maybe initial mass and final mass? Initial mass of your sample. Okay, maybe you have 20 mg sample, 20 mg compound. Let us say 20 mg compound, right? Now, at the end, if you end up getting only maybe 19 mg compound plus 1 mg degradant, how much is the mass balance you got now? How much is the mass balance you got? Initial was a 20 mg, you weighed the compound, and we measured after the degradation. We found, okay, now 19 mg belongs to my main compound, but 1 mg is degradant. So you got mass balance 100%. Yes or no? Suppose you got suppose maybe 18.5%, 18.5 mg as a compound and 1 mg as the impurity. Now, how much is the mass balance you got? How much is the mass balance you got? Is it 95% or 90.5%? I hope you understand, right, how to calculate. So calculate 18.5 plus 1. 18.5 plus 1, how much it is? 19.5, right? 19.5 divided by 20, right? Initial mass, and maybe into 100%. How much is going to be? Yes, how much this going to be? How much is going to be? Is it 97.5? I think, yeah, it's 97.5%. How many of you got 97.5%? Many of you are saying also. So approximately 97.5% is the mass balance. What is the expected limit of mass balance again? Again, there is no guidance which talks about, but generally, the mass balance of in between 95 to 105% is quite widely accepted. What is your mass balance limit? Please let me know in the comment box. Awesome. Many of you are saying. Now, what is the purpose of conducting the force degradation? Why do we conduct force degradation studies? Any reason behind conducting the force degradation? Why there is so much about conducting the FT, especially for chromatographic methods like assay and also for related substances? You do conduct force degradation. What is the purpose of conducting the force? To prove method stability indicating measure Manoj Kumar's response. Kishore says molecular resistance. For checking if method is stability indicating or not, Mohammed says probable degradation products, Hari Prasad says. Sagar says for stability indicating study. For self life, Chetan says. To identify the impurities for our method, Ramu says. Sanjay Kumar says degradation path or degradation pathways. Vijayanta Jayanti Mala says to fix shelf life. Okay, Mohammed says for stability studies. Stability indicating method, Paninder Kuntu. Okay, I mean there are lot many response. They are very similar. They are very true and correct to the sense. The first and foremost to identify degradation product. If you say aspirin, now what degradation product, which degradation product come to your mind? Let me know in the comment box. If you say aspirin, what happens to aspirin in acid hydrolysis? Salicylic acid, right, Sabah? So now these are the interesting products you need to identify before you manufacture the product or before you finalize your method, whether your chromatograph method is able to separate out all the potential degradants. This is your principal compound, isn't it? So to identify the degradation products, you conduct post degradation studies. Understand degradation pathways. So how salicylic acid gets formed? Is it a hydrolysis, oxidation? How nitrous impurity get formed? Is it because of photolytic degradation or is it because of thermal degradation? Now, what is the benefit once you identify the pathways? Pathways are nothing but the root cause. You understand, pathways are nothing but what? Root cause. What is the root cause behind formation of maybe salicylic acid? What is the root cause behind formation of N-nitrosoamine impurities? What is the root cause behind formation of tartaric acid adduct impurities? What is the use of understanding this degradation path? We are packaging control, a very good response, Manoj Kumar. Arpita says you can define the storage condition, also very good response. And you can eliminate those conditions, right? You can eliminate those conditions so that you will not have those potential degradants. Suppose you observe that okay, your product undergoes acidic condition, acidic hydrolysis. Acid. Will you keep the product pH acidic or alkaline? If your product undergoes acid hydrolysis, you will never keep pH as acidic. You will always keep pH little alkaline or at least neutral. Is this information helpful? Hmm? So that is understanding degradation pathway is very critical and very, very important as per as the product development. And it is also important to develop a stability indicating method. So whether your method able to identify the changes happening during stability study, the changes because of humidity, the changes because of light, the changes because of temperature, isn't it? So these are the possible impacting factors. And because of this humidity, because of light, because of temperature, there are certain degradation possible. And you get two degradation from humidity, let us say three from light, and maybe a seven from thermal degradation. Now, is your method able to identify and quantify these all 12 degradants? Yes or no? If answer is yes, now can you say your method is able to identify the changes happening during stability? Yes or no? And then you can say my method is a stability indicating method. Are you able to understand the meaning of stability indicating method? Type yes or no in the comment box. Both Mohammed, your method should be your assay and related substances method. Both should be a stability indicating methods. Yeah, I'm repeating once again. Ritu says no. Harita says, can you repeat? See, what are the impacting factors during stability study during storage conditions? Just imagine you have a tablet in the home now. So under what condition the tablet can get exposed? Temperature, yes or no? Humidity available in the home, yes or no? And the light intensity. Are you clear about these three impacting factor? Type yes or no in the comment box. Now, just imagine and assume because of humidity, if you expose the product for humidity, now you are getting two degradation impurities. These are maybe hydrolysis impurities. Now, because of light, you are getting three degradation products. We'll talk about those conditions also. Just think about this. Now, under thermal conditions, you are getting seven impurities. So, in total, how many degradation products get generated? In total, how many degradation products get generated because of these storage conditions? Are they 12 in number, yes or no? Now, once you have the related substances method, is your related substance method able to separate out all these 12 products? All these different peaks, 12 peaks, 1, 2, 3, 4. This is principal peak. Then 5, then 6, then 7, then 8, then 9, then 10, 11, then 12. Now, is your method able to quantify, identify all these 12 degradants, yes or no? I have shown over here, right? Yes. And if the response is yes, that means what? My analytical method is able to identify and quantify the possible changes over a period of storage conditions. Yes or no? Or my analytical method is able to identify, quantify, detect the changes happening during the stability study. Because this is what happened during the stability study. During stability study, a product undergoes humidity, light, and temperature. And because of that, now I can say that my analytical method is stability indicating in the nature. Means my analytical method can indicate the changes occurring during the stability study, and that is called as the stability indicating method. Are you clear now? Type in yes or no in the comment box. See, method force degradation is well conducted well before your validation of analytical procedures. So you must conduct force degradation to understand, identify. Right. Now define storage condition. Suppose you understand that your product is thermal labile, right? It's thermally unstable. So what condition you can propose? You can propose maybe a 5 degrees Celsius, yes or no? Or maybe minus 20 degrees Celsius. So can your force degradation condition study help you in defining the storage condition, yes or no? Absolutely yes. Then define packaging materials. You understand that your product is undergoing photolithic degradation. Now, what kind of packaging material you can select for your product now? Amber color glass file, right? Amber color glass file. Maybe the glass resistance, whatever materials you have, like alu blister, alu blister rather than the transparent PVC PVDC file or maybe the amber colored glass wire. packaging material be defined based on to the fourth degradation study? The answer is absolutely yes. You can define that. The next one is selection of excipient to stabilize product. Now, suppose you understand that your product undergoes alkali hydrolysis. I am saying alkali hydrolysis means what should be the pH of your product now? What should be the pH? What should be the pH? What should be the pH of the product now? Acidic, right? Acidic pH. So you can have the, so what is the acidic excipient that can be used? Maybe tartaric acid can be used, yes or no? Tartaric acid or any another acid can be used in this case. Fumaric acid, tartaric acid, whatever acid material you can use. Now this is going to stabilize or destabilize your product. This is going to stabilize your product. You understand how the selection of excipient. Citric acid is also a very good example, Srihari. So there are many excipients which are acting as a stabilizing agents. So they can be used for your formulations. And just think about in case of nitrosamine, have you heard about any nitrite scavenger? Nitrite scavengers, what are they? Nitrite scavengers, what are they? Ascorbic acid, right? Vitamin C. Now, this is going to stabilize your, so based on the product study, you define, you know, so sodium nitrite is not a scavenger, by the way. It itself is a nitrosating agent. And there are regulatory requirement also that ICH Q1AR2 is for what? A stability study guideline, Q1B for photo stability study, and maybe analytical method validation requirement to be fulfilled. And in addition to this, you need to understand the requirement of Q3A as well as what is another guideline? Q3B for drug product. Now, this generally helps you to define the limit for those degradants or limit for those the impurities. Scavengers means that simply does not allow the reaction, nitrosation reaction. It stops, that's what, the nitrite scavenger, when they trap the nitrite, they may degrade the nitrite further rather than make them available for the nitrosation reaction. Because nitrosation reaction results in the formation of nitrosamine. And nitrites, like sodium nitrites, is one of the precursor for nitrosamine impurity. So if you trap this nitrosating agent, then there is no further possibility of nitrosation reaction, and hence there is no possibility of formation of nitrosamine. So what are the common stress conditions one can think about post degradation studies? What are the common stress conditions? Common stress conditions, common. So generally, you must have heard about a hydrolytic stress testing like acid and alkali hydrolysis. Have you heard about this, yes or no? Acid basic photo hydrolysis, oxidation, yes, many of them, right? So what is the requirement now? Simulate potential degradation in aqueous environments. This study is generally conducted in the water. So you try to dissolve the sample and have the acid, and then in another case you have the base or alkali. So example is was exposure to 0.1 normal SL or 0.1 normal NaOH at elevated temperatures. You can also have the higher temperature like maybe 50 degrees Celsius, 60 degrees Celsius, or to sometime maybe 80 degrees Celsius, right? And you can increase or decrease the strength of acid as well based on to the degradation outcome. Oxidative or stress testing. So you can evaluate the drug's susceptibility towards the oxidation. What is the condition preferred? Hydrogen peroxide of around 3 to 6%, or even sometimes less, more is preferable. The third one is temperature degradation. So the temperature degradation means what? We are going to expose the sample at higher temperature. maybe 40 degree, 50 degree, 60 degree, or maybe sometimes even 100 degrees Celsius, according to the nature of the product that you are handling. And it could go for weeks or sometimes until the month. Then the photolytic degradation to assess the uh, light degradation of product due to the light intensities. So according to ICH-Q1, we will find two important light sources needs to be used. Which one irradiates the UV radiations up to 100 watt hours per square meter and visible light of 1.2 million lux hours. You can always go uh, you can go beyond that as well because there is no limitations. Network problem. Can you hear me, guys? Okay, okay, fantastic. Thank you so much. Thank you so much. See, Naresh is saying why acid hydrolysis is conducted in water. See, because to get the acid hydrolysis, your acid must undergo dissociation. Your acid must undergo dissociation. So you must select a medium in which your hydrochloric acid or your NaOH base must undergo dissociation. Otherwise, they will not act as acid or base. So aqueous medium is the best medium for their dissociation or ionization. So that's the reason hydrolysis should be conducted under aqueous solution. Now, there could be question like, okay, now I understand that dissociation is required, or but my API, my drug substance, is not soluble in the aqueous medium. See, for this such a condition, you can use the co-solvent. Co-solvent is very well used. So you can use methanol as a co-solvent, IPA as a co-solvent, DMSO as a co-solvent, and co-solvent is for solubilization of your for your compound or the drug substance. So what is the humidity? The next one is humidity stress testing and the water stress testing. So evaluate the impact of moisture and water on the drug product. Now, generally 75% or maybe 80% or 90% humidity is generally preferred for humidity testing. Maybe at 40 degrees Celsius or it could be at room temperature also. And one another condition is just put the sample inside the water and heat at elevated temperature, maybe like 80 degrees Celsius or 70 degrees Celsius. So these studies can be conducted separately. So how many conditions we discussed so far now? 6 conditions or 7 conditions maybe. Thank you so much. Shall we go on discussion for peak purity now? Type in yes, type in R for ready in the comment box. See, once you expose the sample under forced degradation conditions, you have to evaluate the peak purity. You have to evaluate the peak purity. So what is the peak purity evaluation? See, the peak purity evaluation is nothing but the spectral homogeneity. Is nothing but the spectral homogeneity. Because you are going to study this peak purity assessment by using the photodiode array detector, PDA detector, right? PDA. And by PDA detector, you can capture the UV spectra. You can capture the UV spectra of your sample across the various time points, maybe across this particular curve or across this particular peak. So what is the UV spectra of this point? Okay, this is the UV spectra of this point. What is the apex UV spectra? Now this is the apex UV spectra. What is UV spectra at the tailing? Now this is the UV spectra at the tailing. And similarly, you can have UV spectra from this point, this point, this point, this point, this point, and this point also. So you are going to have the number of UV spectra across a given peak, across a given peak. This is a peak now. And then you are going to compare these UV spectra. You are going to overlay these UV spectra, right? If you overlay these UV spectra, are they looking same, yes or no? Now, they may not be looking same because of my drawing inefficiency, right? But if they are overlaying, you can say now they belongs to one and the same compound. But suddenly, if there is a spectra which look like this one now can you see, can you see the whether the spectra the compound is having the spectral homogeneity now? Now these three spectra are okay, homogeneous, but this fourth spectra is not homogeneous. Now what this fourth spectra indicates? What this pink color spectra indicates? What is the pink spectra? Now this spectra indicate that it is coming from the another compound. Other compound, yes or no? Other compound. It may be because of other compound. And this other compound or impurity may be because of the co-elution. So there is a co-eluting compound, impurity. So there is a co-elution possible in case if you find this kind of spectra in your peak, this kind of spectra in your peak. This belongs to other compounds, so it is a non-homogeneous spectra. Evaluating sameness of UV spectra across the peak. So you are trying to evaluate the sameness of UV spectra across the peak. Again, sameness is nothing but the homogeneity. Similarly, same spectra, all are same spectra. They are perfectly overlaying. They are perfectly overlaying. That is a homogeneity sameness. Peak purity may indicate absence of co-elution, right? If there is complete overlay of all the UV spectra, what you can say now there is no co-elution or another impurity eluting in this particular peak. Otherwise, you get some different spectra, right? We discussed in the last example, like this one. Now, this is a co-elution, you can say, for some reason. And peak purity is not a chemical purity. Peak purity is not a chemical purity. The chemical purity is your potency acids different, right? Peak purity nothing but the spectral homogeneity or spectral purity. Peak purity is what it is called as a spectral purity. It is just the spectral purity, homogeneity of the spectra across the peak of investigation. It is not a chemical purity. What are the various stages in calculating the peak purity? The first and foremost, you record the spectra. You record the spectra by using the photodiode array detector. Then extract spectra across the peak. This way, like, look at it. We have extracted the spectra at the leading, at the apex, and maybe at the tailing. They normalize them. What is the normalization? See, suppose, let me give one example. Let me give one example. Let us understand that, you have a exam for of 700 marks and you got 600 marks. Right? Now, another candidate has attended exam with maybe 500 marks and she got maybe 480 marks. So which candidate got more marks? I will say candidate A overshare and candidate B overshare. So is which candidate got more marks? Look at it, 600 is more marks. Why you are saying candidate B? Why you are saying candidate B? Because you can easily realize that the candidate A has got 600 marks, whereas candidate B only got 480 marks. Percent less, right? Percent. Now look at the percent term. So how much is the percent you will get overshare? 600 out of 700. How much is the percent you got here now? Can anyone calculate and let me know quickly? 85.7%. Thank you so much, Ritu. So 85.7%. And how much is the percent candidate we got? 96%. 96%. Now, this is called as a normalization. You understand the normalization? Yes or no? You understand the normalization? Yes or no? Now can you easily compare which candidate has got more marks? Hmm? Candidate B has got more marks. This is simply definition of normalization. Normalization. And once you normalize, overlay them now. Overlay them. Overlay them. See why it is important, why it is required, why normalization is required. Why normalization is required. Now just imagine, now you have a peak. Now this is the peak you have, right? Now just imagine now across this peak, which which part of the peak has a more response or concentration response? Which part of the peak has a more response? Which part of the peak has more response? Apex, right? This is called as apex. And which part of the peak has a low response? Maybe this leading part, right? And the tailing part. Leading part and tailing part. Now, if you draw the spectra of them, how they will look like, because they are the additive terms, right? So you will say apex spectra will have, okay, now this is the spectra of the apex. This is the spectra of the apex. A. And then the leading peak here, the leading spectra, you will say, oh, now this is the leading spectra. Very poor response. Now, are they overlaying with one another? Are they overlaying? Can we identify whether they are same or different? So, you are going to neutralize like these marks. And then you will come to know that yes, now once I neutralize them, normalize them, I get, I get, I get another spectra of my leading as like this one. So got the importance of normalization? Type in yes in the comment box. Hmm? So that's the importance of normalizing because of the concentration difference. Because of what? Because of the concentration difference, because of the response difference. They have the totally different response. Here and here response is not same. So ideally you are going to have the different spectra because of the response. And then overlay them. Let us now understand one example over here quickly. Now this is example, folic acid and methotrexate. So this is the spectra, A, B, C, D, four spectra we have. Now what do you think about spectra overlaying? Are these spectra overlaying? Absolutely no, right? No, so there are multiple components under the peak. There are possibility of multiple components under the peak. Look at here, here is the point. Now second is here now. What do you think about this UV spectra? Second compound, are they overlaying? Is there a spectral homogeneity? Are they same? Is the absence of coevolution? And that's exact. Now, yes. So chances are there is a no component under the peak, and that's why the peak can be. And again, there is some another important calculation like purity angle and purity threshold should be measured. Especially purity angle should be less than purity threshold. That is the acceptance criteria when we talk about empower software. Are we clear until this point? Please type in C for clear in the comment box. Yeah, the peak purity is a huge concept, and we can have a special, a very special session on peak purity measurement as well. Awesome, thank you so much. So, shall we talk about the impurity profiling now? See, impurity profiling is a very critical point, especially for new drug substances and new drug products. So, what do you mean by impurity profiling? You must have seen you're doing some mass study, NMR studies, you know, you are identifying the structure of the impurities, the degradants, you are quantifying those degradants in the sample. So identifying, quantifying these impurities and their possibility in the drug substance or drug product can be called as the impurity profiling. So identification, characterization, and quantification. Identification. This is salicylic acid. And why this salicylic acid? Because you have characterized it by maybe the mass study, maybe by NMR study, maybe by CHNSO study, maybe by IR study. And then you have quantified that, okay, it is 1.5% present in the sample. Is it below or above acceptable level according to Q3A or Q3B? So this all is called as the impurity character profiling. You understand what is meant by impurity profiling? It is not only characterization. It is not only identification. In addition to it, it is also about quantification of that impurity in the given product and identifying its toxicity. Like in today's time, you must have seen that the nitrosamine impurities are having a very low limit now. So you cannot control the nitrosamine by Q3 or Q3B, isn't it? You cannot control the mutagenic substances by Q3 or Q3B. There are specific guidelines for controlling these impurities and substances. So what are the types of impurities present in the sample? The first one is organic impurities, right? Organic impurities. So organic impurity can be a process related impurity, right? It can be a process related impurity, example, intermediates, or can be the byproducts. It can be degradation product also, right? Suppose there is hydrolysis happening because of pH, because of light, because of oxidation. During the process itself, you get some degradation impurities. And they are controlled as per ICH Q3A or Q3B, right? All organic impurities except mutagenic and nitrosamines, they control under ICH Q3A for drug substance and Q3B for drug product. Now there is another type of impurity called as the inorganic impurities. So inorganic impurities can be a catalyst like platinum. It could be a reagent, it could be a residual metals, it could be salt, it could be the filter aids. So whatever is not organic is can be categorized as the inorganic. And these inorganic impurities are controlled under ICH guideline Q3D, that is elemental impurities. The third type of impurity is called as the residual solvent. Now, whatever solvents we generally use for manufacturing, there can be the traces of this residual solvent. So, whatever volatile organic solvent used in API and formulation, and the traces of that volatile organic solvent is called as the residual solvent. And you must have heard about ICH guideline Q3C, which actually decides the acceptable intake limit for this kind of volatile solvent. Now, this is very important point, mutagenic impurities. So, mutagenic impurities can't be controlled as per ICH Q3A or Q3B, and they are highly toxic impurity that may cause DNA mutation or they are cancerous in the nature. Right? So, they must be controlled as per ICH guideline M7. And the last one I would like to discuss is the nitrosamine and NDSRIs. I'm sure everyone must be knowing about nitrosamine impurities. So they are highly potent in the nature. They are called as a cohort of concern, and they have the limit of like maybe a 96 nanogram per day or maybe a 26.5 nanograms per day. So they are highly potent, and that's the reason they are having very low uh, acceptable intake limits. And they must be controlled as per various FDA, EMA, ENVISA, whatever geography you are targeting. According to that geography, you must understand what is the nitrosamines guideline. Awesome. So far we talked about the different types of impurities. We talked about peak purity. We talked about forced degradation study and what is the objectives of forced degradation study. My question is, are you learning something in today's webinar? Yes or no? See, please understand. Now, this topic further needs a deeper discussion. I have just consolidated the important point for your understanding, and my efforts are making you sure that you get the best value for your time and presence. Thank you so much. Now, before I move on to the second part of the discussion, right, it's very important, for me to explain about myself. Can I take some time to talk about myself? Type in P for permission in the comment box, because it is very important for you to realize who I am and how do I qualify for such kind of discussions and the trainings. Thank you so much for your kind permission, guys. So I hope you must be knowing at least me by name. So my name is Bhaskar Napte. I have over 20 years of industry experience, and I have around 5 years of coaching experience. So I must change this as a 5 now, not 4, but at least now 5 or 4.5, because I started this journey in the April 2020. When the COVID hit, we all were locked down. I started this journey of helping people, training people to understand these technical topics. As a career, I worked at various organizations, like I worked at USP, I worked at Glenmark, Apotex, and Dr. Reddy's. Let me also know what is your existing organization, where do you work right now? Please let me know in the comment box. Gland Pharma Akhil, thank you so much. Sanjay Akums, Biocon, Sai Life, Cadila, Lee Pharma, Rajesh in Sun Pharma, Themis, Baxter, Actor International Limited, Hetero, looking for opportunity, Harita, okay, MSN, Ashok works in DRL, Tirupati works in NATCO, Shivanand Aurobindo, Amtech Nepal, awesome, Glenmark, Money. Thank you so much. So I could understand that you are also working in great organization. Thank you so much for letting me know where do you work right now. See, while working in, now what is your number, if I ask what is your number one challenge in today's time, what do you think? This is my number one challenge according to your understanding, because some of you are maybe having 4 plus 5 plus years of experience. Yeah, guidelines understanding is the number one challenge. Okay, I need that number one challenge. What do you think the top challenge that I cannot break? If I cannot break that, I will not be able to. Impurity profiling should not be number one challenge. Mass balance should not be number one challenge. Please understand, think bigger. No, think bigger. Don't stick for this topic today. Understand your career growth, and then realize what is the number one challenge that you are facing right now as far as your career growth is concerned. What is the top the organization? Okay, Santosh is saying top or to work in the top, but what is the challenge you are facing? So are you identifying your challenges? That's the important point. Okay, guidelines are continuously revising. Chetan says that's fine. Okay. About work, what is the challenge about the work? Harinder says knowledge is the number one challenge. That's a good one. Existing role to different role like department change. Ashok, I understand. Switch over is the number one challenge for you. Prince Dubey says basic knowledge is challenge for me. Ritu says learning is a challenge for me. Naresh says improve my knowledge on daily
What's
basis
up?
is finding challenge for me. Kunal says method development,
What's
troubleshooting
up?
during development independently is challenge for me.
Hello.
Sajia says knowledge gap is the challenge for me. Nispal says eager to
Remember,
learn
my
but really
friend.
difficult to understand and practically as a challenge. Continuously improvement is challenges. Ankit. Guided up. I could see many of you have given the right answer and
What's my
I
roommates
can
in
easily
doing?
relate with that. People says that learning or upskilling is the number one challenge. Is the number. Now, why do you
Copilot.
think learning is not possible in the industry setup? Because most of the times our employer or
So, what's the
colleagues
basic principle of
do
particle
not
deposition in
discuss on such kind of
respiratory
important
tract?
topics. Sometimes they do not know exactly, and sometimes they treat their knowledge as a secret sauce, and they don't want to share their nerdlings or knowledge. They say, okay, I learned this knowledge out of hard work I did, and why do I share my hard work with you? That could be the argument they may be having. But irrespective of the conditions, now this kind of technical interactions happen very low on the ground level. How many of you agree on this point? Type in A for agree in the comment box.
Can you describe it largely or more
That people
more
are not ready to share the
more
knowledge.
description?
Your group leader is just for giving you the job, today's task, but he or she may not explain you your questions why. And that is really a dark reality of the pharmaceutical industry. Your manager is just for sake of the manager. How many times your manager has really helped you to understand any concept? They just want to complete the work done. They just want to deliver the project. That's it. No one is interested in your personal growth. There are very few leaders who are really interested in your growth, but most of the times, neither employer, no boss or manager is really interested in your career growth. And that's the reason the learning and upskilling, though it is a number one priority for you, but that becomes the least priority for the boss or the company. I mean, if you agree on this point, it is your problem. It is not our problem. Our problem is just we need the project delivery. That's it.
What is ideal
And
resume
because of
particle
that, people are
from
always busy.
deposition in
They are
respiratory
always
tract?
busy doing something and they don't get even time to look at this technical aspect. And even though someone is really interested to learn, are there platforms? Are there platforms available? Now, that was the biggest challenge I would like to solve as a part of this webinar. How many of you realize that
Okay,
at
okay.
least this webinar
What
has
remains
helped you
in
to
upper
understand
respiratory
some of the
like
challenges that you are
upper
going to type
respiratory
in yes
tube?
or no in the comment box?
What's the range of
This is my
the
sincere
particle?
efforts I'm putting. Now, some of your challenges may not be resolved. I completely agree. But in case if some of you say yes, now some of my challenges are getting addressed, I will be so glad, happy to continue this journey. And that's the only reason I founded the Pharma Growth Hub in 2020. The number one reason because how we people do not get the opportunity for learning or upskilling. Why? Because the learning upskilling is the least priority for boss and the company, and I could not see any platform dedicated for this learning coming together and growing together. And that's the only reason I have created a foundation now, platform which is going to help or helping pharmaceutical professionals on learning different technical aspects.
Why do you use
So
water
far,
like
I must have
robotics
trained more
in
than
your diagram?
20,000 pharmaceutical professionals. And with a direct consultation, I'm consulting more than 2,700 pharmaceutical professionals. And because of this consultation,
No,
once
no,
they join the Pharma Growth
no.
Hub,
In your
they are
background,
able to get
you are
multiple
using
job
amateur
offers.
graphics.
My question is, how many of you are really interested in getting my consultation, my mentorship for the lifetime? How many of you interested to relearn, upskill yourself? And that is the intention behind creating the Pharma Growth Hub. Type in
Ah, I got it.
me in the chat box if you are really interested in joining the Pharma Growth Hub.
What's your limit today?
And thank you so much for all your support. And I will not talk about the joining process of the Pharma Growth Hub
Sometimes
right now,
you gone out of limit and then
but I will discuss
they
about the
say
joining
to
process at the
buy
end of the
with
webinar. Will that be okay?
$1.
Type in okay in the comment box.
So what's your limit
Because
today?
my priority is first complete the content of today's topic webinar. And then at the end of the webinar, I will explain the joining process of the Pharma Growth Hub. Now, my question is, how many of you know that the Pharma Growth Hub has a YouTube channel?
Okay, is Copilot free?
And I do post lot of valuable
But
content videos on
some days
YouTube
ago,
channel.
you tell me to
Would you
buy
like to join that YouTube
for
channel? Would
further
you like to
further
subscribe
communication
Pharma
or
Growth Hub's YouTube
further
channel? If yes, please find the link in the comment box. So please click on the link and immediately subscribe to this one because this is absolutely free of the cost. You get lots of
isn't there
updates
any limitation?
and valuable content on this channel. Now, once you subscribe, type in done in the chat box. If you subscribed already, no need to subscribe anymore.
You're talking like
But if you
hero,
haven't
but
subscribed
you
yet,
don't know
please
anything
30
about
more
the
seconds now
Copilot.
because of time limitations. I would like you to subscribe it and come back quickly. And how many of you would like to connect me on the LinkedIn platform if you haven't yet connected with me so far? Now, please, search for my name and Bhaskar Napte you search for. I hope you will be able to get
So what?
my page or my
What
details over
is
there.
your latest
I
data
also given my LinkedIn
in which day you have
uh,
got
link in the chat
last
box.
training?
So please click on the link and do send me the connection request. I promise you, once the webinar gets
So
over,
where are you
I am going to
updating
approve each and everyone's
yourself?
connection request. Awesome, awesome. Quickly do that, guys, because we need to move ahead. Now, the Pharma Growth Hub
Are you
is
into
ISO
updating day by day?
9001 2015 certified company. So, whatever certificates we are going to issue, they will be
So,
authorized by
Carla,
ISO
কিছু
9001
হচ্ছে তুমি
2015.
তুমি হচ্ছে কেন আপডেট
So, that
করছো না
is
ডে
the
বাই ডে
additional
মানে
value you will
এত
get
পুরান যুগে পড়ে আছে যে
because
এত
of
সুন্দর করে আপডেট হয়
the
এটা ঠিক
certifications
আমি বলতে
issued
পারবো না
from the Pharma
এটা তুমি
Growth Hub.
প্রাইভেসিতে যাও
And
ভুলে
very
যেতে যেটা
recently,
তোমার কনভারসেশন হবে না
uh, where I am going to publish a very interesting book, which is, I think,
I can't
required by
discuss these
everyone
details.
who is interested to create a great career in the pharmaceutical industry. The name of the book is Pharma Career. The book is not yet published by the way, not yet launched by the way, but I am expecting to launch this book on 6th of the March. How many of you would like to order this book? The price of the book is 499 or around 500 rupees. So this is going to be a very interesting book for those who are uh, aspired to create a career in the pharmaceutical industry. And once this book gets published, I will share this link, Amazon link, to those who are really interested to buy the book. And thank you so much, for interested in the purchasing the pharma career book. Thank you so much. I really appreciate your response and the feedback. Yeah, this is a kind of very first book in the industry of pharmaceutical. So There is no
What
another
is
book
protein
available.
peptide delivery?
Just imagine such a huge industry,
What's
and there is
protein
no book
peptide
on
delivery?
how to build a career in the pharmaceutical industry. Anyways, so we are going to have one very soon now. Thank you so much, Heman Patil. Thank you so much. Okay, so let's come back. Type in R for ready in the comment box. Techniques used for impurity profiling. Guys, are you ready for the session number 2? Type in R for ready in the comment box. It's a very important session now. I'm going to talk about analytical techniques which are used in characterization of your different degradation products. Come back quickly, come back. Thank you so much. Thank you so much. So what are the techniques used? Techniques used for impurity profile. Now, there are some techniques which may be required or may not be required. But I try to comprehensively cover all the techniques, but based on to the need of the molecule, one can exclude some technique or you can add some another technique. The first and foremost, you can think about a separation based technique like chromatographic techniques, right? Chromatographic technique. What are the chromatographic techniques when it comes to experimentation? You can think about LCMS. Now, these techniques separate drug substances from their impurities and are widely used in impurity profiling. So you can decide, oh, now this is the impurity A coming at RRT maybe 1.22. This is the unspecified unknown peak which is eluting in this particular sample. So you can specify the impurity based on to some characteristics like RRT or retention time, etc. Now this table talks about the techniques which is available under the chromatographic area and what is the application in impurity characterization. Let us talk about the first point, that is the HPLC. So what HPLC can does, separate and quantifies organic impurities, degradation products and related substances. Now there are certain detectors like RI detectors, ELST, they can also quantify non-chromophoric impurities. Mostly UV detection technique is widely used where your compound is a chromophore which can absorb the UV light. But in addition to that, there are also detectors like refractive index, ELST, they can also use for non-chromophoric impurities or substances. See, UPLC is not much different from the HPLC, but it is called as the ultra performance liquid chromatography because of its speed of analysis. So you get higher resolution, higher sensitivity, and with the least amount of time. Again, the gas chromatography is very important to analyze volatile organic impurities and also the various residual solvents that we can control, define the limit according to ICH Q3C. Then the GCMS can be used. Now in this particular case, you can identify the molecular weight of the compound, right? You can identify the molecular weight of the compound, and you can also have the qualification fragmentation patterns like Q1, Q2, Q3. Then LCMS is it's not a high resolution spectroscopy, but you can have uh, the degradation or the fragmentation of the parent compound. That's a very interesting point. So this particular technique is used for qualification of your compound. You have a Q1 fragment and you have a Q2 fragment. So these fragments will help you to qualify that, okay, now this is the impurity, especially your compound is having. And this technique is widely used for analysis of nitrosamine. So I think this is the very hot topic. And nitrosamine, though HRMS is preferred, but it is very high cost instrument. But MSMS can suffice the requirements. That's the reason the triple quadrupole MSMS is sufficient for analysis of nitrosamine impurities. Ion chromatography can be used for ion compounds, the compounds which can undergo ionization. Then the TLC can be used for controlling the impurity during the process development, which is a quite a crude technique, and you cannot really quantify the substance, but you can understand whether, okay, now the spot is fade, and so the quantity of starting material is low, or the quantity of byproduct is lowered or minimized. So that's the only intention behind conducting the TLC. So HPLC, UPLC, gas chromatography, GCMS, LCMS, ion chromatography, TLC are the main chromatographic technique. Yeah, HPTLC also can be used, Girish. Thank you so much. I appreciate that. I appreciate that. Thank you so much. And then there are certain spectroscopic techniques which one can be used. See, that chromatographic technique is called as a separation technique most of the times. And spectroscopic techniques are called as a structure identification technique. So you can use UV, IR, you can use mass spectrometry, you can use NMR, and those spectrometric techniques are going to help you to actually identify the structure of the compound. So spectroscopic techniques provide detailed information on the chemical structure, the functional groups available in the compound, and molecular composition of impurities. See, now these are the mainstream spectroscopic technique one can think of, like UV visible spectroscopy, which identifies chromophoric impurities by analyzing UV absorption. Then FTIR can identify the functional group based on to the fingerprint region. Then NMR can determine the structure of the compound. Raman spectroscopy can use for solid state impurity identification in the case of polymorphic drug like polymorph A to B. And same is the application of even XRD analysis to identify the crystal polymorphs or polymorphic compound. So these are the structural identification techniques, spectroscopic techniques. And amongst everyone, I think these two techniques are very important. NMR, and second one comes the XRD. Because in today's time, the different polymorph is very important. So always have the NMR for structural identification and XRD for the spatial arrangement of the of the atom in the space, that is to polymorphic stage of the compound. Now the third important point is understanding the elemental analysis. It could be heavy metal. Heavy metal is not the word which can use, but yes, you can think about, because earlier heavy metal was used for, I think, 3 or 4 impurities, elemental impurities, especially lead, mercury, cadmium, arsenic. And then comes the CHNSO impurities. So spectroscopic techniques provide, I think, yeah, elemental analysis techniques. Please forgive me for this typo error now. So elemental impurities does not provide the functional group details or molecular composition. They only determine to some extent maybe the identification of metal present in the sample, or CHNSO gives the configuration of percent of carbon, percent of hydrogen, the percentage of nitrogen, maybe percentage of sulfur, and percentage of. So based on to this composition, you can qualitatively define the possibility of the formula of the compound. So this is a secondary identification test. This is not a primary or fundamental one. So yes, ICP-MS is well known and widely used now in terms of identifying and quantifying the different amount of elemental impurities. ICP-OES is also used for analysis of different elemental impurities. Even you can use atomic absorption spectroscopy and CHNSO analysis for understanding the content of carbon, hydrogen, nitrogen, sulfur, and also oxygen. So oxygen is missing, so this is typo error from my side. See, in today's time, if you ask me which is important, so ICP-MS is important now. ICP-MS is very, very important. And then comes the CHNSO, that is the secondary structural identification. ICP-OS is not important if you have the ICP-MS. AS is not at all required if you have the ICP-MS. So these two techniques are must as far as elemental analysis is concerned. Okay. ICP-MS is used for elemental profiling, yes. Inorganic impurity profiling. See, understand, we have many types of impurities, and inorganic impurities are quantified, are identified based on to the ICP-MS, ICP-OES, AAS, and not CHNSO, but CHNSO can be used for especially organic impurity identification. Then what is thermal analysis techniques? Now there are thermal techniques which also help you in identifying the impurity details. So these techniques help in detecting thermal degradation impurities, polymorphic changes, and stability issues. Now polymorphic changes is a very interesting area where DSC can be used. So DSC can help you to understand the polymorph and drug excipient interaction that way. TGI is also very important in terms to understand the moisture, solvent residues, and thermal stabilities. Differential thermal analysis is also important in terms of measure exothermic or endothermic degradation reaction. So according to me, at least these two techniques must be performed. The first one is DSC and second one is TGI analysis. These two are important techniques. Now DSC will help you maybe the polymorphic forms, right? What is the polymorphic form of the compound? And a TJ will help you to understand the moisture content and sometimes uh, the number of water molecules like monohydrate, dihydrate, trihydrate, tetrahydrate. So that can be identified based on to the TJ analysis. So that is very important for you to define. And then the last one comes the residual solvent and volatile impurity detection. Now, these methods detect the trace amount of solvents, especially organic solvents, which is used during the manufacturing process. And headspace GCs can be used. Even liquid injection technique also can be used for volatile residual solvent. And Carl-Fisher reagent can be used for especially water content or residual moisture. Now, there are certain combination hyphenated techniques. Means you have suppose iron, right, plus any another technique, right? That is called as hyphenated technique. Like LCMS is hyphenated technique, or LCNMR is the hyphenated technique. So the combination of two techniques can also increase the value of analysis. So these advanced techniques combine two or more methods to provide detailed impurity characterization. For example, LCNMR, or liquid chromatography, plus nuclear magnetic means you are going to separate out this compound first, and then this separated fraction will get inside the NMR. So you can have the NMR of multiple peaks which is appearing on your maybe the chromatograph, like LCMSMS or GCIR. So these are all the hyphenated techniques, and they are also important to define, characterize the separated compounds onto the liquid chromatography or gas chromatography. So I would like to summarize whatever techniques we discussed so far, and this is the important table according to me. So in case of chromatographic techniques, you have this many techniques: HPLC, UPLC, GC, GCMS, LCMS. In case of spectroscopic technique, we have UV, IR, NMR, and Raman. Elemental, we have ICP, MS, OES, AS, and CHNSO you can think about. Thermal analysis, we have DSC, TGA, DTA. Residual solvent, we have headspace, GC, Carl Fisher. And hyphenated techniques, we have like LCA plus NMR, LC plus MSMS, and GC plus IR. So these are the techniques one can utilize for characterization of your impurity. Chromatographic techniques, spectroscopic techniques, elemental analysis, thermal analysis, residual solvent analysis, and in case if you have the advanced techniques like LCNMR, LCMSMS, they also can be used. I hope you are clear about techniques used for impurity profiling. Are you clear? Thank you so much. Appreciate your response and the feedback. Awesome. Now, here is the important point. Once again, I would like to reiterate the factors affecting on formulation related impurities. And in this particular slide, we'll talk about three important factors and how these three important factors can influence the drug product and can generate the degradation products or impurities. The first and foremost, we talk about the adverse temperature. So drug substance that degrade at elevated temperature includes those with thermolabile functional groups, especially proteins. You must have seen that the proteins are highly sensitive toward temperature, and there could be the unstable polymorphic forms, right? Unstable polymorphic forms get transferred to metapolymorph to the stable polymorph. So this can happen because of this may be a low temperature and this could be at high temperature. So high temperature can convert your form 1 to metastable form 2 and maybe from metastable to stable form 3, polymorph 3, right? And same is the protein. Protein get denatured at high temperature, right? So high temperature is not good for some products. Now these drugs degrade via maybe oxidation, maybe because of decarboxylation, or maybe because of the rearrangement reaction. Let us understand the mechanism of heat degradation. See, I am trying to explain some of the important mechanisms which can be behind thermal degradation for your product. The first one is because of higher temperature, oxidation can take place. Like vitamin C can oxidize to dehydroascorbic acid, right? Now this is a one example, and you can see, okay, now my product also undergoes thermal degradation. So what is happening? Is it oxidation or is it something else? So there could be a decarboxylation taking place for suppose your product. Means in decarboxylation, the loss of carbon dioxide happens in your API. So because of thermal treatment, decarboxylation is possible. And the third can be isomerization or rearrangement, like cis to trans conversion, or maybe this one conversion of your R isomer to maybe the S isomer. This is called as the isomerization reaction, and this is possible because of the higher temperature. So these are the three prominent mechanism of heat degradation. One is oxidation, second is decarboxylation, and third could be isomerization. Even there is a chance of cis to trans, or there can be a different chiral impurity forming, R chiral impurity to S chiral form. The second important factor is light. So because of now there are certain products which are photosensitive when exposed to UV light or daylight, and they can undergo photolytic degradation. So drug conduct containing chromophoric group like aromatic rings, conjugated double bonds, nitro groups or halogens absorbs the light and may undergo photolytic degradation. So you can understand the possible risk of photolytic degradation in case if your compound has a halogens like fluorine, chlorine, bromine, or nitro group, N double bond O group, that means your compound likely to undergo photolytic degradation, or your compound has aromatic rings. What is the mechanism of photolytic degradation now? How photolytic degradation takes place? The first one is photooxidation. Example, nifedipine forming nitroso compound. Photooxidation. Oxidation happens because of the photo or because of the light energy. That is the nitroso. Means what? There is a addition of oxygen over here. The second one is photolysis. Chlorpromazine breaking into inactive compounds. And the third can be isomerization. We talked about isomerization in the last case, cis to trans, etc. is possible because of exposure of light also. So these are the three, again, the prominent mechanism under which photolytic degradation can happen. And the third one is humidity. So this is another third important factor because of which your drug product may undergo degradation. So because of hygroscopic and hydrolyzable drug substances absorbs the moisture, which can lead to hydrolysis. So what is the mechanism now? The first one is hydrolysis itself. It could be like aspirin hydrolyzing and giving the salicylic acid. Then moisture induced oxidation like levodopa oxidation, or physical instability like hygroscopic drug powders clumping. So this is not actually the chemical change, but this can be called as the maybe physical change. I hope you got a little clarity about the mechanism behind the important three factors: the thermal, light, and humidity. Are we hearing this for the very first time? This mechanism of action? Type in FT in the chat box if you are hearing or listening this mechanism for the very first time. Thank you so much. I could see lots of you are talking about that. Thank you. Thank you so much. And now this is a very interesting point, and I am going to cover now the three important actions. The first one is stress testing, second one is stability testing, and third one is actual testing. See, in entire lifespan of the product, what happens first? What do you conduct first? You first conduct the stress testing or degradation study, yes or no? Then you conduct stability study. And finally, once you have the product launch, you conduct the release testing or actual testing. So these are the three important stages of any product under development. You conduct stress testing or FD, then stability study, and then the actual testing. Now I'm going to demonstrate these three different stages of the product with these three circles. And I'm going to call the first one as the knowledge space, the outer circle. The middle circle is called as the design space. And the last one, the inner circle, is called as the control space. So what is going to be the knowledge space now? Which one can be knowledge space according to you? Is stress testing going to be knowledge space? Is stability testing going to be knowledge space, or actual testing going to be knowledge space according to you? Example, Thapa says stress, Mena says stress, Dispal says stability, Anuja says stress testing. What is going to be? Kunal says stress and stability both. See, knowledge space is going to be what is maximum possible to your product. And this only can be identified because of what? Because of stress testing. Because of stress testing. So whatever stress testing you are doing, acid hydrolysis, alkali hydrolysis, thermal degradation, photolytic degradation, you get A, B, C, D, E, F, G, H, I, these many impurities. And this is the knowledge space you got now. Okay, the bigger space, right? Whatever possible, I come to know because of this stress testing. Now, what is the design space going to be now? Because stress testing is been recognized as the knowledge space. Is it a stability testing or actual testing? That has to be decided. Design space. It is going to be, Arina says stability testing. Like, yeah. Number says stability, Anuja says stability. Absolutely. Rita says actual. Okay. Now it is going to be the design space going to be your actual stability testing. So out of this A, B, C, how many impurities are there? 1, 2, 3, 4, 5, 6, 7, 8, 9. There are 9 impurities. Now out of these 9 impurities, how many impurities are actually found in the accelerated and long-term testing? 1, 2, 3, 4, 5. Only 5. And that's the reason. Oh, it is a smaller circle. Are you getting my point? 9 impurities, bigger knowledge, bigger circle. And out of this 9, maybe all not getting into accelerated and long-term testing. You get only 5 in this case. Am I wrong? 1, 2, 3, 4, 5, right? Now, out of these 5 accelerated impurities, what is the chance that these impurities will get observed in actual testing? Now, there may be not 5 impurities, but less than 5. Here there are 9 impurities. Here there are only 5 impurities. And but in the actual testing, you got only 3 impurities. And that is the design space. Are you getting the importance of connecting stress testing to stability testing to actual product testing? Please type in yes in the comment box. So let me ask you, what shall be your specification now? Whether your spec should contain 9 impurities, 5 impurities, or 3 impurities. What shall be your specification containing? 9 impurities, 3 impurities, or 5 impurities? Yes. Shahja says 9, Anuja says 3, Harinder says 3, Meena says 5, Satendra says 5, Nispal says 5, Aniket says 9, Mohammed says 5, Kunal says 3, Somnath says 5, Dambar Thapa says 3. Awesome. So there are different opinions. Okay. So if you keep only 3, there is a slight risk you are taking. Yes or no? You are slight risk taking. Because these are the probability during the over a period of time. If there is a excursion outside storage condition, excursion. If you have the excursion, there may be, okay, fourth impurity coming in plus 1. Possible, not possible? Maybe because of your transportation. Yes or no? And hence, I prefer to have these 5 impurities in your specification. 9 is not required because 9 is just a potential impurities. So I think 9 is not required, but 5 is the preferred way in defining the specification because you are going to cover lot of risk because of the excursion outside storage condition. How many of you agree on this point? Type in A for agree in the comment box. Awesome. Thank you so much. Now we are going to discuss about a case study. Ready for the case study? That's what going to be a very interesting part of the webinar today. Let us take a very important case study now. And what is better than metformin hydrochloride? So how the synthesis process takes place? How the metformin gets synthesized? So metformin is synthesized from dimethylamine hydrochloride and cyanogonidine in the presence of hydrochloric acid. So the reaction can be represented by this way. Dimethylamine hydrochloride plus cyanogonidine present of hydrochloric acid. Now this is not the technical reaction. I've just given the rough reaction and result in the formation of metformin hydrochloride. Now understand what are going to the process related impurities. Now the first and foremost, the unreacted dimethylamine can be the process related impurity. Same is the case, unreacted cyanoguanidine can be the process related impurity. There could be side reaction product like NN dimethyl bigonidine, right? So understand how the process related impurities can be identified, how they can be separated during the reaction. Now then comes the force degradation study. So degradation products identified during force degradation. So you have conducted FD now. So what products you identified? Okay, you understand, you identified N-nitrosodimethylamine or NDMA, it is nitrosamine, under acidic and oxidative stress. So you got NDMA. You got bigonide impurities formed under alkaline conditions. But what is actually stability testing says? What is accelerated data talks about impurities? So you identified NDMA during the stability studies, and you also identified hydrolytic degradation product under the high humidity condition. But what is the impurities observed during the routine testing? When you actually formulated a product, packaged in real packaging situations, and stored at the preferred storage conditions, you have got residual solvent IPA and related substance as NN-dimethyl bigonide. So these are the two impurities. I mean, one is organic residual solvent you got, and second one you got as the organic impurity. So this is the way you can define now the impurity profiling for the metformin. So this is the actual specification. Maybe you can include NDMA, you can include hydrolytic impurities, you can include N-dimethylamide bigonide, and you can include residual solvent. So total 1, 2, 3, 4 impurities can be included in your final specification. Now here is the last point I would like to walk you through, and it is about analytical interpretation. Ready for interpretation? Type in R for ready in the comment box. Now this is going to be the interpretation of NMR, interpretation of mass, and interpretation of IR. And I am going to take an example of which one? Yes. What is example going to be? Which impurity I am going to discuss now? Wow, there are some responses. Let me read now. Valsartan, NDMA, nitrosamine, none of them, none of them. It's a very old product. And the name of the molecule is aspirin. Name of the molecule is aspirin. What is going to be the impurity of aspirin now? Now it is not aspirin, it is not one cyanogon. It is going to be impurity of aspirin. What it is? What is the major degradant product of aspirin? Type in salicylic acid in the comment box. Fantastic. So we'll talk about salicylic acid now. Okay, we'll talk about. See, this is the mass spectra of salicylic acid. This is the molecular formula. So how you can interpret, how you can represent the data, that is very important. So whenever you create the report of characterization, I think you must put this information, minimum this type of information, like molecular formula, what is the molecular weight, what is the molecular ion peak M plus M by Z ratio, what is the major fragment ion you identified, like M by Z of 120 is because of what? Okay, it is because of loss of water, that's minus 18 mass. Then loss of CO2 gives M by Z of 92, that is minus 42 mass. and this is a benzyl fragment of M by Z of 65. So this represents, how your mass spectra is going to look like, right? Different masses and different fragments. So what is the proposed fragmentation pattern? Now, molecular ion peak of 138 represents the intact salicylic acid, but ionized salicylic acid. Loss of H2O, that is M by Z 120, represents due to decarboxylation, loss of CO2. Sorry, decarboxylation, no. Due to H2O, no. This is because of H2O. Dehydration, right? Dehydration. What do you call that? This is because of not decarboxylation. I'm so sorry. And then the further loss of CO2, it's okay to understand breakdown into benzite fragment. Let us now talk about NMR, and there could be proton and carbon 13 NMR. And you can see the intensities and you can understand the singlets assigned to a specific functional group like phenolic hydroxide, carboxylic hydroxide, then hydrogen from carboxylic acid, ortho to hydroxyl group, meta to carboxyl group, or meta to hydroxyl group. And the same is the carbon 13. You can understand that CO of COOH is identified at this particular frequency. Carbon to OH, COH is from 155 to 160 frequency. C1, C3, C5 ring carbons in between 130 to 140. C2, C4, C6 ring carbons between 120 to 130 frequency. And the last you can talk about the understanding of the FTIR. So there are OH trace because of the hydroxyl and carboxyl hydroxide group. Then the CO stage in between this wave number can be because of carboxyl group. 1200 to 1400 is because of the CO stage functional group, that is phenolic OH. And rest or other you can read over it. It's called the fingerprint region. So best, I think these are three important analytical techniques. One must understand, mass, NMR, and IR. Rest all are not very critical. You can easily, interpret those techniques. Like XRD is not difficult to interpret. TGA, DSC, they are not easy to interpret. But I thought of discussing at least these three techniques in today's webinar in short. If we get a time in any future webinar, we will try to cover the full-fledged webinar onto the impurity characterizations only. Awesome. Thank you so much, guys. I hope you have got the value of today of your time. Type in yes or no in the comment box. Yes, I tried my best to explain the four degradation studies, peak purity. We talked about impurity, a profiling part. We talked about interpretation of the major analytical tools. Now my question is there benefit, is there benefit of knowing such kind of technical aspects? This is conclusion part we have just covered in the previous slide. What are the benefits? I always say that the confidence level can certainly get increased because of such kind of technical knowledge. Do you think it is possible that your confidence can be high because of understanding of NMR, mass, IR interpretation? Yes or no? Understanding how to do the impurity profiling, everything is important. And do you think you can be eligible to get higher salaries? You can get your interview cracked very easily by showcasing your expertise in different techniques. Yeah. And it's very important because of all this knowledge, you will be respected in the industry. And I think respect is above everything. Isn't you cannot compromise your self-respect for any reason. And the self-respect is very much possible if you have this kind of expertise or knowledge. And next important point is because of all this, you can achieve the fastest possible growth. and more importantly, you be working on a meaningful, a important, challenging, crucial product for your organization. Now, please let me know in the comment box how many of you would like to achieve all these five important aspects into your career. Please type in me in the chat box. You need to improve your confidence, get high salary, get respect, growth, and meaningful project. In case if you really value these five aspects, if you really value these five important aspects, you can consider joining the Pharma Growth Hub. Now, why? Because through the joining of the Pharma Growth Hub, you can achieve all these five important aspects. Now, the question is, how many of you are really interested to join Pharma Growth Hub platform? Because if you remember, during my introduction, I'm going to talk about joining process at the end of the webinar. So how many of you are really interested to join Pharma Growth Hub? Type in me in the chat box. If you are really interested, you please continue watching the webinar. If you are not interested, you can please step out of the webinar because I really don't waste your time. But in case if you're really interested, curious, wanted to understand about the Pharma Growth Hub platform, you can continue watching the webinar, and I'm going to explain very soon how you are going to join the Pharma Growth Hub. So guys, are you ready to understand the joining process of the Pharma Growth Hub? Please type in R for ready in the comment box. Awesome. Thank you so much. See, the Pharma Growth Hub is supporting, helping, serving the pharma community since 2020, almost 5 years now. And so far, more than 2,700, 2,700 professionals have joined the Pharma Growth Hub. Now, how many of you know that almost 70 to 80% job openings get fulfilled through maybe a referral or networking? Please type in me in the comment box. And hardly 20 to 30% openings get published on the job market. And most of the times, people fight for these openings. Yes or no? People fight for these openings, and you lose 70 to 80% of the job openings. How many of you would like to grab this 70 to 80% opening? Please type it me in the chat box. Please type in me in the chat box, because once you join the Pharma Growth Hub, you can network with 2,700 professionals. And through this networking, you can grab the premium roles. Is that amazing? Type in A for amazing in the chat box. And this is happening in reality. Many pharmaceutical people are able to get job openings because of our platform. Now, how many of you realize still there's a lot more to discuss about peak purity, force degradation, impurity profiling, analytical techniques, and their interpretation? Please type in me in the chat box. So I have created some self-paced learning programs. And this program is going to discuss the important topics up to the huge depth. And these are in the form of the pre-recorded videos, right? They are in the form of the pre-recorded videos. So they are not going to be the live classes like this one, but they are going to be pre-recorded videos. Now, how many of you are really interested to access this pre-recorded videos or self-paced learning program? Please type in I for interested in the chat box. See, because during this webinar, I have a limitation of the time and I cannot explain the topic to the depth, right? But in self-paced learning program, I have enough amount of time and I can go at any depth as per my requirement and the knowledge. Now, once you go through today's webinar, how many of you have the question? Type in Q for questions in the comment box. Do you have the question? Type in question in the comment box. I am sure everyone who is attending the webinar must have at least one or two questions. Yes or no? Is it important for you to get answer of those questions? Yes, right? Now, to get answer of all your questions, will you be happy to connect me on every week, on every Saturday 8 p.m.? Type in yes or no in the comment box. I am going to answer all your questions on every Saturday during live class. That is going to be our weekly technical live support. Is that something amazing, guys? Type in A for amazing in the chat box. So the Pharma Growth Hub is not only providing a self-paced learning program, but also providing an opportunity to connect with many people to answer your questions. Would you like to get a premium job roles through our community? Please type in J for job in the chat box. See, in today's time, the number one challenge for many professionals is to identify, get the desired job openings, and they don't get it very easily. The struggle is very huge, and I wanted to make this journey little easy for all of you. And that's the reason we have created a private Telegram group for job openings. Is that something helpful? Type in H for helpful in the comment box. So our 2,700 successful professionals regularly post job openings inside this job opportunity group. And that's how you get to know what is openings available in X company or Y company. Similarly, we have a private Telegram group for a technical discussion. Now, see, everyone is going through a challenge. Everyone has some challenge in routine works. So it is very important for me to solve your most of the challenges. And for to solving your challenges, we have a technical discussion group. And finally, all these services will be provided not for just a month or a year, but they are provided for the lifetime. Type in A for awesome in the comment box. So type in wow in the chat box. So I wanted to have a longer association with everyone. So how many of you have found these services really valuable? Type in V for valuable in the chat box. Because maintaining the platform, it's not that easy. I need to study a lot first myself. I need to undergo lots of training myself. I have to run my website up and running, Zoom calls, and there are lot many investment I need to do from my side. Now to join these services, because you get a lot of valuable services and information, you have to ready for a little amount of investment. How many of you are okay with the investment? Type in okay in the comment box. Because see, just realize and understand, run and keep this platform ready. How much efforts I must be taking myself. I have a smaller team who is working around. Advertisement cost, platform cost, website cost, huge amount of cost is required. So I am expecting a little amount of investment from your side so that we can come together, we can learn together, and we can grow together. Now, those who are really okay with the investment, and this is going to be a very small amount to be very frank. If you want to know the amount, please stay until the end of the webinar. I am going to present a Pharma Career Accelerator program. Now, what is the content of this program? By the way, this program is appreciated by many of our community members. Like Sarika said, okay, it's not only my confidence, but I could able to boost confidence of my team members also. Many people are able to get multiple job offers like Kalyan Kumar got because of the same platform, because of the same blueprint. So I am presenting the 25 different courses out of the Pharma Career Accelerated program. So now please understand, all these courses are technical courses. And I need to explain the content of these courses. And for that reason, I need at least 4 to 5 minutes time. Will that be okay? Type in okay in the chat box. So I will walk you through each and every course because for me, you must understand the content of the course at least before taking the decision. So the first important course is Method Validation Mastery. See, we'll talk about fundamentals of each parameter. And how many of you really want to know about the peak purity assessment, calculation of purity angle and purity threshold, how to conduct the, how to design the force degradation study, how to design the precision accuracy. Please type in me in the chat box. So lot of content will be explained in the very first number course about the method validation. So whatever questions you had about peak purity measurement, purity angle, purity threshold, all that will be discussed, explained in the first course. Now the second course talks about, now this is the market value of this particular course. I forgot to talk about that. This is not the final amount you have to pay. Rupees 3,990 is the market value of the method validation mastery course. The second course is again about assay validation, how to actually execute assay validation. This is going to be a practical or implementable course. This is not the theoretical course. All my courses are theory plus practical or implementation. This is the structure of all our courses. So you understand how to design concentration matrix, protocol, result, and report. Similarly, you have the dissolution validation course and related substances validation course. I hope you understand the four initial courses which are based onto the validation aspect. The fifth course talks about HPLC development. Sixth course talks about the gas chromatography development. Seventh course talks about dissolution method development, and eighth number course talks about spectroscopy, which is covering UV plus FTIR method development. So major techniques are covered in the development courses. The ninth number course talks about mutagenic and nitrosamines. So we'll talk about requirement of various guidelines like USFDA, EMA, Canada, TG, and VISA, and many another important points which are really important for you to implement mutagenic and nitrosamine effectively. The 10th number course talks about impurity management blueprint. So how one can define the limit for known, unknown, and total impurities, limit for residual solvent, limit for elemental impurities, and many more. Course number 11 talks about extractables and leachables. Now this is one of the huge topic of discussion right now, because if you ask me which one is the fastest growing dose of administration, and that is going to be injectables. Injectables are increasing like crazy, and you must realize the importance of extractable and leachable study, because injectables needs the extractables and leachables. So all the requirement is provided in this particular course. The course number 12 talks about ICH quality guidelines. So these are the ICH quality guidelines which have explained in this course in the form of very simple language, in the form of the videos. The course number 13 talks about how one can design the specification. The course number 14, how one can calibrate the common lab instruments along with the templates, formats, protocol, reports, everything. How one can qualify the common lab instruments. Again, the protocol, report, templates will be provided for your personal use. The course number 16 talks about clinic validation. So how one can conduct the clinic validation will be explained in this particular course. The course number 17 talks about how one can conduct stability study according to WHO, ICH, and VISA, ASEAN countries, and many more. The course number 18, 19, 20, 21, these four courses are based on to the manufacturing requirement. The first one is design and qualification in the manufacturing, like GMP facility, HVAC, HEPA filters, all that will be explained in the course number 18. Course number 19 talks about Schedule M's good manufacturing requirements. Course number 20, what is USFDA's good manufacturing practices. And course number 21 talks about WHO's good manufacturing practices. The 22 number course talks about audit and compliance. So how these different bodies like USFDA, EMA, TGA, and VISA conducts the audit, and how you can be ready for audit every time will be discussed in the course number 22. The course number 23 talks about quality management system like deviation, OIS, OT, CAPA, change control, QRM, investigation tools like 5-Eyes, Fishbone, FME, and many more. The course number 24 talks about CSV, and course number 25 talks about FDA's observations received to Indian pharmaceutical companies. So please understand, these are the content of 25 courses. Let me ask you, how many of you found the content valuable? Please type in V for valuable in the chat box. And thank you so much for your response, by the way. See, the total market value of this content is more than a lakh rupees. But I am going to provide an offer or a special offer for today's attendees. So please type in SO for special offer in the comment box. And let me provide the special offer for those who are really interested to get into Pharma Growth Hub. And thank you so much. Thank you so much. So please understand it's not going to be 1 lakh rupees for sure, but it's only going to be at 12,999 or 187 US dollar. Now, in addition to this 25 programs, I would like to provide something bonuses to all of you. So please type in more in the chat box and let me share what extra courses, what extra bonus you are going to receive with the today's offer. The first and foremost, are you interested to learn about process validation? Type in I for interested in the chat box. We will talk about types of process validation, ISO 13485, process capability factors, process capability index, risk assessment, URS, and many more points. So this is going to be a bonus course number one for everyone. In case if you're interested to learn about quality by design or QBD, now this is the second bonus that you are going to receive with the same offer. With the QBD, we'll have the third course called as the analytical QBD. This is the third bonus you are going to have with the same offer of 12,999 or 187. In addition to that, you will be participating our weekly live technical support call. I call that as a inner circle call. Now I am conducting inner circle call since 2021 and there are more than 150 plus sessions happened so far. So you can access recordings of all our weekly inner circle call. All our previous inner circle call recording will be accessible to you. The next important, how many of you are really interested to join our job sharing community? Please type in B in the chat box. You will be able to join our job sharing community also. And also our PGS discussion forum too. So please understand the 25 programs from Pharma Career Accelerated Program plus 6 special bonuses coming total 31 programs with the total price of 1,53,000 Indian rupees. But all of them along with my mentorship for the lifetime is available at rupees 12,999 or 187 US dollar. My question is, are you ready for a time sensitive offer? I am going to make the offer little better for everyone. If you are ready, type in R for ready in the chat box. Because this is a lifetime opportunity for you to invest into Pharma Growth Hub for the betterment of your career and transformation to 2.0. So please understand, it is going to be a 15 minutes offer only. And if you invest right now, it is not going to be 12,999 or 187, but it is going to be only 8,999 or 127 US dollar. Let me know how many of you are now interested to get into Pharma Growth Hub. Please type in I for interested in the comment box. This is the smallest amount, smallest investment you have to make today for getting on the highway. Please join the Pharma Growth Hub and avail all these services. There is not going to be any renewal fee. This is going to be one-time transaction. Understand the benefit, one time. So you need not to renew the program, you need not to renew the license of accessing. This is a one-time payment. You can access all these programs for the lifetime. Let me know what else you are looking for. Can you see the link in the chat box? Type in yes or no in the comment box. No? Okay. Now for YouTube viewers, I am going to provide Google Pay or Phone Pay option. So please check Google Pay, Phone Pay option right now. And by using the Google Pay, Phone Pay option, you will be able to complete the transaction. So Dattatreya Jadhav, you are interested. Lana Greg, Sherin interested. So please, those who are interested. And in case if you want payment links, so please just allow me a few more moments now. And I'm going to provide the payment links in the chat box as well. I have given the payment link for Zoom webinar viewers, so please go ahead. Now, this is the first payment link, that is the, what is that? InstaMojo link. Okay, so let me provide the InstaMojo link. Guys, are you really ready, yes or no? Because, yeah, I will provide the alternative links that you can use. If you are from international attendees, you can use the PayPal's link. You can use the PayPal's link. So this is the PayPal's link now. I'm just putting the PayPal's link for international attendees. Just a moment. So it is going to be a payment of 127 US dollar. Those who are outside India, they have to make a payment of 127 USD. So please, you can check the PayPal link now. This is the very easiest way of completing the transaction for international attendees. And for Indian attendees, you can use this many options. Let me give the InstaMojo link now. Rupees 8,999, right? And here is the link. Yeah, just a moment. I say I have to type the link. I don't know why it is not getting copied. SJG. Double 37. Okay, so do you got the InstaMojo link as well, YouTube viewers? Can't reach, refresh, what happens? Oh my God, this link is not working. Okay. This link is not working or working. I can't able to open. What happened? Yes, yes. It's a wrong link, so I am going to delete this now. See, here is the InstaMojo link. I'm so sorry. For rupees 8,999. SJG, SJG. Okay, now this is the correct link. Can you try now? Oh, click on the link now, and it will take you to 8,999 page. So for international attendees, I have given the PayPal's link now. Just click on the PayPal. You can log in. You can send. Click on the send button, and you will be able to complete the transaction. Right. So please let me know in case if you have any issues in making the transaction. And if you have done the payment, please type in payment done in the chat box. Yeah, I'm so sorry. I have taken some more time to guide YouTube viewers today because I'm not able to copy and paste the link to the YouTube. Working now, yeah. Greg, let me know in the chat box. Shirin, let me know in the chat box. The Tatreya Jadhav, please let me know in the chat box. I've tried to provide the link now. Yeah, so Chandrasekhar, congratulations and welcome to Pharma Growth Hub. Manoj Kumar Suru, congratulations and welcome to Pharma Growth Hub. So those how to do payment from Pakistan. So I think Pakistan is not accepting the PayPal's link. I am not sure. Can you try with the Razorpay payment link? Just try and let me know. I think you will not be able to make a payment by using either Razorpay or InstaMojo link. You need to make the transaction by using, I don't have any option for you. I'm so sorry for that. Yes, so let me know, Greg and Serene, have you done the transaction? So I'm leaving now YouTube and I'm going back to, yes, here on the Zoom. Thank you so much. So how we are going to make the transaction of using InstaMojo account? It's very easy. Simply click on the InstaMojo link that you can see in the comment box. Provide the name, email, phone number, and you'll be able to do that. Same is the case for Razorpay also. And in case if you are interested to make a payment by Google Pay, Phone Pay, I have given the Google Pay, Phone Pay number over here. Plus, you will see the Google Pay, Phone Pay QR code also. So in case if you are interested to make a payment by Google Pay, Phone Pay, please take the snapshot of this slide and you can scan these QR codes and easily make the transactions. 30 more seconds for scanning. Thirty more seconds for scanning. I hope you must have done it right now. And those who are making the international payments, click on the PayPal's link, click on the send, right? Click on the send. Sometimes it is important to create your own PayPal account. It's very easy to create PayPal account. Just follow the instructions and steps. You'll be able to do that. And add the amount as 127 US dollar, right? In case if you want in your currency, understand equivalent amount into your currency. That's also okay, right? If you want to make in pound or something, you can make equivalent to 127 US dollar. I hope you understand that. Awesome. So see, out of this now this is the 15-minute slot. I would like to provide all the action takers and the time starts now. So those who are really serious about career growth, if you really want to make some different moving guide in 2025, this is the right time to take the action. Please take the support. You need support for sure. You need support of networking, our community members, and I am there forever to support you, all of you guys. 8999 or 127 is the only investment you have to make today to get on the Pharma Growth Hub. And this is going to be lifetime access, lifetime mentorship. Are you ready for joining? Yes or no? And if you think whether the program is worth of it, please understand. This is the feedback I received from Vulcan Benson. And she herself is a consultant or trainer. You can see, read over here. This is her LinkedIn, the page. And she wrote that I saw the trainings were really at the level of scientific explanation and extremely detailed. So all our course content are designed very scientifically. In case if you are really interested to, get a job outside India, you are always welcome to network with people like Parvin could able to get a job in USA in Moderna. Atish is working in UK, and there are many people who have found the job outside India. Madhuri could able to grab multiple job offers because of the same networking opportunities. So please think over it. It is only 8,999 or 127. You get all requirement, everything that is really supporting your career growth. So please have a look to this small 2 minutes video and understand how people are getting benefited. I run this 2 minutes video for you now, guys. Just have a look.
Hello, everybody. I was quite impressed by the energy and devotion of the Bhaskar sir for making a farmer growth hub. Amazing. He's truly passionate about what he does, and that itself is captivating.
Myself, Priyanka. I'm working as a senior analytical chemist in Almaty, UK. I joined the Pharma Growth Hub 8 months ago. This is a good platform, and it's not just for freshers or graduates, it's for the individuals who want to develop their skills and knowledge.
Hi, this is Balasubramanian Swaminathan. As an analytical professional, I have a lot of questions. How do I upgrade my skills? What is the best way to learn what is happening in the industry? Who is the one point source whom I can approach to when I have any issue, when I want to take the next step in my career? All these questions got answered when I had an opportunity to get into Pharma Growth Hub.
I must say I'm blessed having a member of this group, because one way you will learn so many things, because there are so many people involved in this group. Those have day in day out experiences, troubleshoots. They will discuss with you in group. Like we have WhatsApp group, and in that they are regularly interacting with each other and sharing their knowledge and experiences. That is huge.
And basically, when I joined PGH, at that time I don't have even confidence to attend the interviews. And now I am attending interviews like
Oh,
don't
excellent, excellent. It-
don't even say कि कितने सारे इंटरव्यू शेड्यूल हो गए with confidence they are giving me offers. मतलब I have offered by 3 companies. Then I selected one.
Yes, sir. Nowadays, we are getting so many interviews from this platform also. Suppose any vacancies are available, respect to company, they are posting in this group.
Yes.
Yes, based on that, every people.
Awesome. Thank you so much for finding a time, taking a time to watch this 2 minutes video clip. How many of you really got inspired by hearing them type in I for inspired in the comment box? Now, these are the real people present onto the Pharma Growth Hub platform. And you heard them speaking, right? So you will also get able to talk to them. You will be able to get the same benefit the way they are able to get it. Thank you so much. I really appreciate those who have taken the action. For those who are still sitting on the fence, my sincere suggestion, please think over it. It is half of the price of your smartphone. I don't know whether smartphone make you smart or not, but this platform can certainly make you smart. Okay. So 8,999 is a one-time transaction, a lifetime access, or it is 127. Now there are 25 certifications available as a part of this entire program. 31 programs, but out of the 31 programs, 25 programs has the certifications, and you can see the certifications has the ISO logo, and it also has the ISO certification number. So this is going to be a valid certification worldwide. I hope you understand the importance of this certificate. This is going to be valid with the certification of ISO number. The first one is assay method validation, second one is dissolution, third one is related substances, fourth is stability study mastery certification program, fifth one is instrument calibration, sixth instrument qualification, seventh is QMS mastery, eighth is cleaning validation, ninth is mutagenic nitrosamines, 10 is ICH quality blueprint, 11 is extractable leachables, 12 is HPLC method development, 13 is GC method development, 14 is dissolution method development, 15 is spectroscopy method development, 16 is analytical method validation, 17 audit and compliance, 18 is design and qualification in the manufacturing, 19 is good manufacturing practices according to WHO, 28 is good manufacturing practices according to US FDA, 21 is JMP Schedule M, 22 certifications in analytical QBD, that is AQBD. 23rd is certification in QBD or quality by design. 24th is process validation in pharmaceutical manufacturing. So these are the 25 programs which has the valid certification. Type in A for amazing in the comment box. You get the certifications once you complete the program. This is a complete automated process. Once you watch all the videos, the e-certificate will be issued to your registered email address. So how this program works? All these are self-learning programs, self-paced programs. There are 25 programs where you get certifications. You will get lifetime access for all these 31 programs. There are some downloadable resources like templates format. You can download them. You will be able to join our job openings group. You can join technical support team, and very interesting, you can join our weekly live support call. Now my question is, what else you are looking for? 31 programs, 8999, all this inclusive. 1,53,000 worth value. Offer 8999 or 127 lifetime access. So please let me know now, how many of you have done the payment by Google Pay, Phone Pay? See, those who have done the payment by Google Pay, Phone Pay, you have to provide your name and email address. Please understand this point. I think Chandrasekhar, you have made the payment on Google Pay. Anyone who has made the payment on Google Pay, Phone Pay, please provide your name, email on this WhatsApp. Anyone who has done the payment on this Google Pay, Phone Pay, please do provide your name details, email details on the WhatsApp. You can see in the chat box and on the screen. Another important point, those who have difficulties in completing the payment, suppose you are not able to make a transaction, please contact us on the same WhatsApp number. Our team will certainly help you out. And here is the time, small break, 5 minutes break, where in case if you have any question about pharma growth of programs for payment, you can certainly contact by chat box or the WhatsApp. I am going to be available for all your support. So please take your time. It's 4 minutes and 47 seconds time for this offer to end. Thank you so much and look forward welcoming more action takers.